Hello, we are going to present a lecture on tropical diseases and the related concepts like epidemiological triad and the chain of infection. So let's structure our lecture. We will first start with the introduction to tropical diseases. Then we will discuss the epidemiological triad and the chain of infection. Then we will define communicable diseases and we will describe some diseases that are specific to climate conditions. We will also discuss in this lecture some of the most important terms and the concepts that are related to TCD. At last, we will discuss infection control protocols, including the precautionary colors. So, what are tropical diseases? The diseases that occur predominantly in tropical and the subtropical regions, which are areas near the equator with warm and the humid climates. So we try to understand the equator. Basically, the equator is an invisible line that circles the middle of the earth, that is located exactly halfway between the north and the south pole. So it is the primary reference line basically for the latitude and is designated as 0 degree latitude. And the areas near the equator are tropical and the subtropical regions like Pakistan, India, Bangladesh, Africa. So if we talk about the feature of tropical areas, so these include high temperature, high humidity, and high rainfall in these areas. Diseases that occur in these regions are the tropical diseases that often caused by pathogens like bacteria, fungi, viruses, and the parasites that thrive in this environment. Factors like poor sanitation, limited access to the clean water, and the vectors like mosquitoes, also the flies, contribute to their spread. So what are vectors? Vectors are basically the transport vehicles for the causative agent to enter into a host. So if we talk about the epidemiological triad, so it is basically a model of three interconnected components that actually tells how the disease is transmitted while also explain its influencing factors. So these components include the agent, which is a pathogen that causes a disease. It may be a fungus, it may be a bacteria, virus, or the parasite. The second component is the environment, which are the external factors or the condition that influence the agent's ability to cause a disease and the host exposure. So these conditions may be poor sanitation, humidity, condition favoring mosquito growth, hot and the dry weather. And at the last, we will discuss the susceptible hosts, which include the humans who have the tendency to get a disease. Basically, these are the at-risk hosts with risk factors such as low immunity, underlying disease condition like diabetes, and also the age such as children and the older adults who have the weak immune system. So if I give an example of the triad of the tuberculosis, so its causative agent is Mycobacterium tuberculosis, and the environment that influences its ability to cause a disease include overcrowded places and the pre-summer season. Hosts include humans, with majority of cases occur between the 20 and the 40 years of age, but it can occur at any age. So let's discuss the chain of infection, which consists of a sequence of events that tell how the infection spread from one host to another. Basically, it consists of six interconnected steps, and breaking any link in the chain can prevent the spread of disease. The first step or the event include the infectious agent, which is the pathogen that is responsible for causing the disease. The second component is the reservoir, which is a place where the pathogen lives and multiplies. The third component is the portal of exit, which is a way the pathogen leaves the reservoir. The fourth component is the mode of transmission that tells how the pathogen travels from reservoir to a susceptible host. The fifth component includes the portal of entry, which is a way the pathogen enters the susceptible host. And the last component or the sixth component is the susceptible host, which is an individual who is vulnerable to the infection. So if I give an example of chain of infection for the tuberculosis, the agent is Mycobacterium tuberculosis. And the reservoir include infected humans or the TB patient, also reside in cow or beef meat. And through coughing and sneezing, Mycobacterium tuberculosis leaves the infected person. And through droplet in the air, it reaches the nasal mucosa or the oral mucosa of another susceptible host, which are basically the humans, mostly of age between 20 to 40 years, but can occur at any age. The question is how to stop or prevent the transmission or spread of disease. So basically, breaking any step in the chain can stop the disease spread. For example, wearing mask can break the fourth step, so it prevent the disease spread. So what are communicable diseases? Communicable diseases are basically the infection that spread from one person to another or from a surface to a person, from an animal to a person. So basically, these are spread by microbes like bacteria, viruses, fungi, and the parasites. So there are many types of communicable diseases, which include airborne, which are majorly the respiratory disorders such as COVID-19. Similarly, the waterborne diseases that are caused due to the contaminated water, which include cholera and the diarrhea. So, vector-borne diseases that spread through mosquitoes and the flies, such as malaria and the dengue. And at the last, the contact-borne diseases, which mostly include skin diseases like measles and the mumps. So, if we talk about some specific diseases due to specific climate conditions, so humidified conditions favor malaria and the dengue. Similarly, dry conditions favor skin allergies, worms, or the gut infestation, and the respiratory allergies. So let's discuss the important terms or the concepts that are related to tropical and the communicable diseases like epidemic. Epidemic is basically the occurrence of a disease in a community at a particular time. For example, cholera and the measles. Similarly, the dengue fever in Lahore in 2011. The endemic means the occurrence of a disease within a specific geographical area, such as common cold or the malaria in Pakistan. Similarly, pandemic, the occurrence of a disease affecting worldwide population, such as influenza and the COVID-19, that affect the whole world. If we discuss about the outbreak, which refers to a sudden increase in occurrence of a disease. Similarly, incidence basically refers to the first ever reported case, and the prevalence refers to the people with disease in specific area at a specific time. Incidence basically tells about incoming cases, and prevalence basically tells about the present cases. So it's a minor difference in the incidence and the prevalence. Now we are discussing the most crucial aspect of the TCD, that how we can prevent such diseases through proper adherence to infection prevention protocols. The first rule is the hand hygiene, which basically reduces the 50% infection risk. The second is the environmental cleaning and the disinfection, which includes cleaning beds, floors, and sterilizing equipment, which contribute to patient safety from such diseases. The third one is assessing the risk and deciding which personal protective equipment is needed. PPE basically include gloves which protect hands from the cross contamination, and the mask which cover mouth and the nose and protect the respiratory system. Similarly, the gown which covers the body, and the goggles that protect the eyes from the splashes. Using germ-free procedure or the aseptic techniques while injecting, dressing, or inserting a catheter. And at the last, always wearing mask while placing catheter or injecting the epidural that prevent from the splashes. So let's discuss the isolation precautions. So these are the precautions that we use to isolate the patients according to their disease condition by giving them a specific color. For example, blue color is for droplet, and the precautions include mask and the distance. Similarly, green color is for the airborne diseases, and the precautions include mask and a negative pressure room. And at the last, yellow color is for contact borne diseases, And the precaution we use include the gloves and the gown. So this was a brief overview of the tropical and the communicable diseases. I hope you found this video helpful. Make sure to subscribe to our YouTube channel for further interesting topics. Thank you.